wash my hands. Hello, Judy. Welcome back to our clinic. Again, my name is Sky. I'm a nurse practitioner, and today you are here for an abdominal exam, right? Okay. Can you tell me your full name?
Judy.
Okay. All right. What's your date of birth?
1984.
Okay. And what's the date today?
Thursday.
All right. So, do you have any health concerns today? Okay. Do you have any pain right now?
No.
Okay. Do you feel shortness of breath?
No.
Okay, good. So my patient is 8 times 4. So her general appearance is appropriate to the situation, and there is no acute distress. Okay, so now let's lay down flat at the exam table, and I'm going to expose your abdominal area so we can start the inspection. Okay. Let's go a little bit. Good. Okay, so first we are going to start with your abdominal inspection. So by looking at your abdomen, so your abdomen is symmetry. Okay, patient abdomen is symmetry, flat, no visible mass or swelling. And now, so the patient abdominal skin is warm, dry, intact, and there's no visible rash or scars, only birth stretch mark noted. Okay, the umbilical is no bulging or swelling, and also the peristalsis and the aortic pulsation is non-visible. You okay? Okay. Now I'm going to listen to your abdomen. Okay. So the abdomen, normally we divide the abdomen in 4 quadrants, and this is from the umbilical side. We divide it in 4 quadrants. So I'm going to start from the right upper quadrant. Use the diaphragm. Okay, the abdominal sound is present and the normal active. Left upper quadrant is abdominal sound is present and active, normal active. Left lower quadrant present, normal active. Okay. Right lower quadrant abdominal sound is present and normal active. Now I'm going to listen to the aortic artery pulsation. Okay, there's no burette. The left kidney, left renal artery. Okay, no burette. And the right renal artery. No burette. And the left iliac arteries. No burette. And the right iliac artery. no worry. And I'm going to listen the left femoral artery. Negative, and the right iliac, right femoral artery. No worry present. Okay, so now I'm going to next is precus the abdominal. The technique is I'm going to use my left hand, middle finger, and the middle part of the middle finger to press firmly down against the patient's skin, and then I'm going to use the right hand middle finger to strike, and then to detect the sound. Okay, start from the right upper quadrant. Tympani, left upper quadrant. Tympani, left lower quadrant. Tympani, and the right lower quadrant. Tympani. So the general sound of the abdominal is the percussive sound is tympani. And next, I'm going to percuss the liver span. I'm going to start from the mid clavicle line, down from the right mid clavicle line, down from the umbilical cord, umbilical side, until I hear a dullness. Then I'm going to make a mark when the first sound change from tympani to dullness. And from the upside, the mid clavicle line, start from the nipple level, go down until I hear from the sound change from rosen to dullness. And then just use the tape to measure the tumor. And the liver size here is about 7 centimeters. So 7 centimeters will fall within the normal limits, which is normally between 6 to 12 centimeters. And next, I'm going to precuss for possible splenomegaly. I'm going to start from the left, around the left cardiac side. Start from the 6th intercostal space. Okay, so the normal sound around the cardiac line should be tympani. Take a deep breath. Okay, so when the patient take a deep breath and the sound still remains tympani, so which will be indicate for non-splenomegaly. And if the sound change from a tympani to dullness, then that will be a sign for possible splenomegaly. So now I'm going to palpate your abdomen, which is like I'm going to push down in your abdomen. Okay. So the first is the light palpate, about 1 centimeter to 2 centimeters. I'm going to go light palpate for all 4 quadrants, and to detect any superficial mass, tenderness, or swelling. So those are negative. And then I'm going to do the deep palpate, which will be depend on the patient, normally go from 3 to 7 centimeters. But for a patient like her, I'll go about 3 to 5 centimeters. Okay. Tell me if you feel pain. Okay, so same time I'm going to look at my patient's face, looking for grimace for possible pain. Okay, so there's no mass or tenderness detected, and the patient indicates there's no pain. Okay, so now I'm going to palpate the patient liver. So I'm going to start from the 1 centimeters. Okay, so I'm going to put use my left hand to support my patient, the right side anteriorly at the ribs, about 10 to 12 ribs, to support it, and then use my right hand to start to deep palpate, like 1 centimeters under the costal area. Okay, take a deep breath in, out, take a deep breath in, out. Alright, so I can feel the liver is slowly meet my fingertips when the patient exhale. Okay. Now I'm going to palpate the spleen. Use my right hand to reach over and support her back. And I'm going to use my left hand to feel the intercostal space. Deep breath in, out. Okay, just under the costal space. Deep breath in, out. Alright, so I can feel the spleen. So next, I'm going to palpate the kidney. From the left kidney first. Still use my right hand to support. Take deep breath in, out. Okay, deep breath in, out. One more time. Okay, so it's now palpable. Okay, I'm going to palpate the kidney on the right side. Deep breath in, out. Deep breath in, out. All right, so the kidney on the right is also not palpable. So now we're going to test for a rebound tenderness, which will be testing for appendicitis. Okay, so I'm going to draw a line from the umbilical to the right side, the process of the ileum, and about 2 centimeters above the meeting point. I'm going to palpate deep and then let it go fast. Feel any pain? No? Okay, let's do one more time. Any pain? Okay. So the rebound tenderness test is negative. Okay, now let's do, I'm going to do the fluid wave test. I'm going to hold my left hand at the kidney level and use my right hand finger to tap. Do you feel any pain on the right side? No? Okay. Okay. Now I'm going to test the Murphy's sign. Murphy's sign is indication for Murphy's sign is indication for like a gallbladder infection. I'm going to deep palpate at the mid clavicle line, like 1 centimeters down from the costal space. Take a deep breath in, out. Do you feel any pain? Okay, deep breath in, out. Are you ready? Okay, so there is no grimace on the patient. But the patient did indicate I pushed down too hard and it hurts her a little bit, but it's not affected by her gallbladder though. Okay, now you can put your shirt down. Now we are going to do another test. This is also testing for the appendicitis, which is the first one will be the Riversing sign. Sorry. So I'm going to push down the left lower quadrant. Ask patient if you feel pain on the right lower quadrant. Do you feel pain on this side? Okay, I mean on the right side. Do you feel pain on this side? No. Yes or no?
No.
Okay. So the Robertson sign is a negative. All right. Okay. Now I'm going to testing for what it called is psoas and abdomen sign, which is I'm going to lift up my patient's leg to hyperflex to ask if she feels any pain. Do you feel any pain? Okay. Do you feel any pain? No. Okay. About this now. Do you feel any pain? No? Okay. Do you feel any pain? No. No? Okay. So the psoas sign and those are negative. All right. Now please sit up. Okay. Facing me, please. Okay. Stay right here. Okay. So the last test will be called the costal vertebral test, which is test for kidney kidney infection. All right.
Mm.
Hold up your shirt like that. Okay. Now I'm going to gently tap on her right kidney. Any pain?
No.
But now?
No.
Any pain? No. Okay. So now testing the patient's left side, left kidney. Any pain?
No.
But now? But now?
No.
Okay. So the costovertebral test is negative. There's no tenderness and no pain when I tap the patient's kidney. Okay, Judy, so your exam for today is finished. So everything looks good, and thank you for coming. All right. Do you have any questions for me?
No.
Thank you.